Hey guys, it's Shantaria. So today I wanted to kind of talk to you guys about tips on making it through nursing school successfully. So let's get started. So just kind of like my previous video, the first tip I give everyone is organization. That is number one. So if you're just starting out in nursing school and you haven't already got a planner, get one. I use it. It's my life. If I don't have things written down, everything goes in disarray. So get a planner. Write everything down. I used to, when I had my syllabus, I would write down when my tests were, and I automatically knew that I was having a quiz every week coming to class. So I would just write down each chapter, what we covered, so I can make sure I read. Because most of the time, my quizzes were after class, after the lecture, but reading beforehand, going to class, so you kind of already know what's going on. You may not understand everything, but you have a grasp of what she's going to be what he or she is going to be talking about, so you can have a better understanding once they go more in depth with it. And that will help you tremendously with your quizzes in order for you to be successful. So stay on top of your reading. That is crucial. Staying on top of your reading. Some people can get by without, but for me, staying on top of my reading, having things written down so I know like when my tests were coming up and things like that, helped me a lot. So that's my advice to you about that. Also, as far as like your skills, because I know that you have to do like a skills test out with Foley care, trach care, wound changes, NG tubes placement, and taking out the NG tubes. Practice, 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 practice. I can't say that enough. I know when you go in, like you get that feeling in your chest, like, oh my God, I'm gonna throw up, I'm gonna vomit, I can't do this. But take a breather, calm down. As long as you practice the methods at home, practice the sterile techniques at home, you will do fine, okay? Whether you have to practice on your child, or if you don't have any kids, a stuffed animal, a friend, a significant other, somebody. Just have somebody practice on them. I practiced on my son. I practiced on a stuffed animal before. I practiced on my mom before. So whoever you can use them. What was cool with my mom is she's also a nurse. So like if I was doing something wrong, she'd be like, yeah, so we may want to read back on what you're supposed to do because that wasn't right. So that was also helpful as well. But organization for your planning, and then like I said, staying on top of your reading to prepare yourself for quizzes and tests, staying on top of your skills because you will have test outs on that. Also with like simulation test outs where you have to go in on the dummy and do like a head to toe assessment, and they create a scenario, and then we have to figure out what's going on and call on the doctor. I'm not gonna lie, those were like the worst moments for me. I passed them all, but I dreaded it. Like my heart would beat so fast every time I had a simulation test out. So for that, like I said, if you know your skills going into like the simulation test out, you're gonna do good on the skills part. But it's not just about skills, it's about the physiological aspect of what's going on, trying to figure what's going on, and figuring out what are we going to do to solve this problem. So of course, critical thinking, and that's when the studying part comes in, because if you've been up to date on your readings and studying like you're supposed to, then you're going to do fine. You're going to blow it out the water. You may be nervous. They have you like pretend like you're calling the doctor and following SBAR, and I'll do a video about SBAR, like how, you know, situation, background assessment, and recommendation on, you know, just a good SBAR handoff report. So and then drug calculations, you're not going to get around it. I'm sorry if that's what you think. Yeah, I work in the ER, and I'm used to like just pulling my phone out and like, let me put this calculation in real quick. But no, you can't do that. You have to be able to think on your feet, because when a doctor tells you they want 120 of whatever medication, you need to be able to think on your feet and pull that in emails, and so we can administrate it. So you're not going to get away with it. Make sure you know your math, know it, practice it. There are YouTube videos. The book I had, I think it was called Calculate with Confidence or something like that. It was awesome. It gave me a great breakdown for everything. So I really like that. So whatever your schooling recommends or requires that you use for your math, make sure you know that down pat into the T. It's really important, especially when you're dealing with pediatric patients, and everything is, you know, weight based when you're giving medications and things like that. So yeah, so basically studying, even in the summertime, don't slack off. I mean, I know summer is for relaxation and all of that, but make sure you stay on top of your studies throughout the summer, so you're not like, oh man, I forgot that we did that when the next semester starts, because that can kind of put you behind, or, you know, it can put you forward if you got the book already in the summertime and you're kind of just reading through. It doesn't have to be every day, but just kind of refreshing yourself and staying in that study mode, because I know when you come back to school, it's really hard to get back into that study mode. I was like, really, I've been off all summer and now I have to come back to studying. Yeah, even with me now working in the hospital, I still find myself getting off of work, coming home, studying medications, studying different diagnoses, because when you're in the ER, you have to be a jack of all trades. It's not just, you know, one specialty. So I find myself still studying and staying on top of things, because I want to be a great nurse, and in order to be a great nurse, you have to do continuing education. So I hope you guys like this video, and if you did like it, please like, comment, or subscribe. Thank you.